And we're going to have a time for Q&A. There are two specific questions I am going to ask first. Dr. Ogbuagu, I know you have written your answer on the sidebar, but I think for the benefit of people, they want to hear from you. It's is it recommended to mix and match vaccines, Dr. Ogbuagu?
So that's a great question. The one trial I mentioned that's evaluating that is actually being done in the UK, which is they're doing the mRNA vaccine with AstraZeneca. And it's actually in a way, either you get AstraZeneca first, then mRNA, or you get mRNA first and AstraZeneca. And they're also trialing two different intervals, 4 weeks or 12 weeks. So there's literally 4 arms. So till we have that data, we don't know if one vaccine diminishes response to the other or if it boosts the other. My sense is that they should work pretty well. I think it should work. I don't have any concerns why mixing and matching shouldn't work, but we don't have that data yet. And so, I like us to make recommendations based on data because there's always unanticipated things that can happen or surprises. Okay, so I think that question was tied to someone who maybe didn't, maybe took the first dose and is concerned about the side effect. I think between the excellent presentation by Dr. Jaisimi and myself, that that it's even less than rare. Some of these side effects, again, the advantages of getting that important second dose to boost your immunity far outweighs any minuscule tiny risk of a side effect that may not even occur. And remember, if they've received the first dose of vaccine and did fine, there's always a chance that when they get the second, you'll still be okay.
What opportunities are there for Nigerians to join your institute? What qualifications do they need? And what kind of studies would you recommend?
At SGIT, we run different kinds of trainings. We run both foundation training in genomics and advanced training in genomics. So depending on what qualification they have, but anyone with life sciences degree, they are qualified to come over for training, and they can also apply depending on the positions and the availability of space at the center. So please feel free to contact me. I would direct accordingly.
What is the time space or time frame for receiving the AstraZeneca vaccine after taking the first dose?
Again, the AstraZeneca vaccine trials suggested that if you got it 12 weeks apart, you had higher protection than if you got it 4 weeks apart. And it was actually interesting. The longer you spaced it, the higher the protection. Okay. There's certain reasons why that could be the case, but I think it's some of them are quite speculative for now. So again, I think that, remember I told you we have the trial that's looking at the 4-week and 12-week interval. I think that's trying to address that very specific question: does the spacing of the doses matter? So we're going to learn more about that. So, but for now, I would say till we have that data, I think taking the vaccine every 4 weeks should be the norm. Now, from a public health standpoint, you could argue, right? An argument could be made, not that I support that, but that if you don't have enough vaccine for everyone, and then you want to use the limited supply you have to vaccinate more people, especially given the data we have about how well one dose of vaccine works, I think you could argue from a public health standpoint that you could delay the second vaccination. The point is not to not give the second vaccine, but to delay it, okay, I think can be a reasonable strategy where there's limited supply.
Professor Jaisimi, this is a question. You gave some data that there are currently about 135 million cases of COVID-19, almost 3 million deaths, and 419 million vaccinated, which is about 5.3%. So we are very much at the cusp rather than anywhere. Am I correct?
That's correct. Yes. That's because when you look at it globally, I mean, in the United Kingdom, we have done very well in terms of vaccination. America is catching up. Other Western world, Israel, for example, has done very well, perhaps virtually vaccinated its whole population. But when you look at Africa, and Africa, I mean, I can't remember how many doses were supplied to Nigeria. There are 200 million people in Nigeria. I doubt if we got, I don't even know the numbers, maybe
I think
2
it was
million.
4 million, the first
Of,
batch of AstraZeneca.
yeah, 4 million, and we're 200 million. So when you look at that, that's why the number of people who have been vaccinated globally is as low as 5%. The African and perhaps the North American, the low income countries where they can't buy the vaccines or they haven't had access to purchasing the vaccines have diluted those who have received the vaccine. And I can tell you from experience in the United Kingdom, the vaccine is effective. It's brought down number of cases, number of deaths, number of severity. We're reopening the hospital to other things. So it is effective. And I would say, please, if you have the opportunity, receive it. I'm just going to say one thing you haven't you haven't asked me. But the AstraZeneca, from experience of people who talk to me, some people do have symptoms or side effects that knocks them down for a few days. They feel unwell, temperature, headaches, body pain. Usually what I tell them is, one, it's your body reacting, and secondly, use paracetamol, Panadol, Tylenol, and hydrate yourself. And be ambulant. More so with this talk about blood clots and stuff. Try and move around, hydrate yourself, and that it will pass away. And most people have come back to say, oh, yes. I mean, I got scared one day because a lady got to the vaccine center, phoned me. Oh, she's there. Should she have it? I said, go ahead and have it. Then she had side effects. I was phoning her every day to find out how she was doing. And she's okay and she's come out of it. So there's no vaccination that hasn't got potentially side effects, but they are treatable and they are not life-threatening.
I think the way to go forward now is to just come to reality that these diseases will keep coming. Just like Dr. Ogbuagu has said, we will keep having these pandemics, we'll keep having these outbreaks. As long as human population is increasing, as long as urbanization is on the increase, we will keep having them. But one of the things that we all need to do is to know that let our government be able to embrace genomic surveillance. Like Professor Jaye Simi and Dr. Ogbuagu had said, we need to be prepared for it. And the only way to be prepared for it is to go all out and search for these things. Zoonotic diseases now, One Health is the order of the day. That's what everybody is talking about. That One Health, which is looking at pathogens that are present in animals as well as those ones that can become infectious to human beings. And so we need to just keep searching for this. And just like I said, we have to just continue to be hunters of these pathogens so that once we know them, that they are in existence, then we start preparing countermeasures and public health interventions. One of the things that genomics have done, based on even the presentation as we see, is all these years that we've had malaria, we still haven't found a solution to it. But then because genomics has come a long way, and like I said in my first few slides, that the genomics have changed created a paradigm shift. And so it made it that we were able to develop a vaccine within a very short period of time as against other pathogens that have been in existence all this while. So I would say that with what we know, I think we should start embracing genomics and encouraging it in our environment. Thank you very much.
Thank you very much for your important comments. And I think you're right. I think that some of us in different ways could be strong advocates for what we would like to see, not just in Nigeria, but in the African continent, frankly, which I think is left behind on so many levels. You know, I have volunteered to be part of Africa CDC's task force on coronavirus. I actually chair one of their subcommittees. And just, thinking about the gaps that exist in Africa with regards to even genomic surveillance, data generation and management. There's just so many gaps. A lot of good people are thinking about it. I was on a call yesterday with Nigeria CDC Director, Dr. Chikwe Ihekwazo. Everybody is thinking about ways to make sure that the lessons we've learned, the gaps that exist, that we're thinking about ways to address them. So, it's already, the ball has already been set rolling, and we've all in our own way tried to trumpet what we think are ways that we can start to set up systems, sustainable systems. But you point out an important issue, that resources are an issue. I think our governments don't invest in research and in science. And it really starts, some people have asked me, where does it begin? I think even from the primary school, I think there has to be huge investment in our teachers, in technology, in science, in infrastructure, that we need to, because we have so much talent on the continent, we have so much interest, but we just need to create that enabling environment for our people to thrive. Nigerians are the most educated immigrants in the United States, right? I mean, but many of us shouldn't be there, right? We should be back in our country without being kidnapped, right? To support some of the work that's being done. That was a joke, but anyway. So yes, the issue is that many good heads are thinking about it, and I think that would be one of the legacies of COVID-19. That because it has unmasked or unearthed or shown us how poorly prepared we were for this pandemic, I think we'll come out on the better end of things and be better prepared for the next one.
I thank you, Prof, for what you raised, the question you raised. Yeah, you've said perhaps we are also contributory to the deaths in Africa or Nigeria. What I'm going to say is perhaps that's not the situation. Perhaps we don't talk about what we do. There's a group called Doctors for Change that at the first wave donated a lot of things to Nigeria, ventilators, PPE. And I can tell you that as we speak, money is being raised again to get things to bring to Nigeria. That's number one. We talk about the enabling environment. I'm looking forward to the Ogbuagu Foundation, but you need an enabling environment. I mean, there is a group in the United Kingdom called the UK Nigeria Diaspora COVID-19 Response Group. We've contributed to the Presidential Task Force. We've contributed to the Federal Ministry of Health Home Care Management document. Then we work with NIDCOM. But I know you, and again, we've got the Africa CDC, we've got the West African Health Organization. We are talking to these people. But where there's no political will, no matter how much you have, we know how much Bill Gates pumped into Nigeria for polio and malaria. We know where those money went to. People who were supposed to be vaccinated sat at home and were ticking papers that they vaccinated. It was only trackers on their phone that exposed what they were doing. But we hear what you say, and that is the way forward. Private sector and the public sector getting together to work for the advancement of all. But where there's political unrest or war, then it's going to be very difficult for those kind of foundations to thrive. But let us reassure you that we have not forgotten home. There's no place like home, and we take on board what you've said, and we will work towards it. There are lots of people doing great stuff, but they don't probably talk about it or shout about it.